Root canals may seem intimidating and sound scary, but really they are not. They are a straightforward procedure that can treat and save a tooth. Hi, my name is Whitney. If you're new here, welcome. If you've been here before, welcome back. Today we're going to watch a root canal procedure at the dentist, so you'll know exactly what's going on during your appointment. And before we get started, make sure to get my free oral care guide. Click the link in the description below or in the pinned comment to discover all of the essential components for an effective oral hygiene routine at home to help maintain a healthy smile by preventing cavities, tooth infections, preventing all the things that lead to needing a root canal. And having said that, now let's walk through a root canal appointment. When tooth decay or a cavity goes deep into the nerve area of a tooth, the process of repairing or saving this damaged tooth is called root canal therapy, aka a root canal. So the first thing you'll do is take a seat into the root canal room. Usually there's lots of stuff in the room that can look overwhelming, but truly don't worry about it. It's not something to be overwhelmed about. Next, the dentist or the endodontist will make sure you get nice and numb so you won't feel anything during the procedure. Here you're seeing the patient get nice and numb from the anesthetic. All you'll feel is a little pinch, and then after, it's smooth sailing. Oftentimes a bite block and saliva ejector will be placed in the mouth as well before the dental dam is secured. The bite block helps the patient not have to stay open wide the whole entire time, so it prevents the patient's jaw from getting fatigued. Now that everything is ready, you can see that they are securing the dental dam in place. Then they may place a caulking material. It seals around the tooth and it helps block out any fluids that may be coming in and out. So now that we're all set up, the first thing the doctor will do is remove the tooth decay. You can see that they are drilling the tooth just like they would during a routine filling procedure, when a cavity is being removed and a filling is being placed. It's the same type of drilling happening right here. Next, they may use an explorer to check the area and make sure the nerve is ready for root canal therapy. If it's ready, then it's time for the RC prep and the files. The RC prep is the white stuff you see here. It helps lubricate the canal so the hand files can go down into the canal, which brings us to the hand files. This part is kind of hard to see, but what's happening is that the files are helping clean out and open up the canal. So depending on the technique that the dentist uses, they may use a bunch of different sized files. Again, you will be super numb during this whole process, so you won't be feeling any of this. The goal of this part is that they are trying to get into the tip of the canal so they can have a working path to the apex of the tooth. The apex of the tooth is the terminal end of the root of the tooth. So an apex locator is this machine that you see here. That's the part that's attaching to it. You'll normally hear a beeping sound during this part. Now you can see rotary files being used here. They are different from the hand files because they are used with a power-driven instrument. Next, the hypochlorite is used. This is a cleaning solution that cleans and lubricates the area. You want this area cleaned and lubricated. And an ultrasonic also might be used to get straight line access down to the root tip so that the files won't bind. Once they have straight line access, they have confirmation of the depth. An x-ray may be taken now to document this. You may also now hear the dentist and assistant calling out numbers back and forth, such as 20.5, 20.5, 21.5. In this case, in this video, the length to the apex is 20.5. So depending on how many canals there are, you might hear lots of numbers being called out back and forth. Now, back to the files and the hypo solution. This might be a pattern for a little bit. They will be reconfirming the length with the files. The goal of the files again is to open up the canal. Here we are flushing all the organic material out and all of the infective material out, aka bacteria. We want to flush all that out. So this pattern of the files, cleaning solution, files, cleaning solution, files, cleaning solution, that might happen a few more times. And then after they are done with that pattern, next up is the ultrasonic streaming agitator. This helps get the solution to go further and deeper. It's kind of like stirring up the sugar in coffee. I really like that analogy. It's so it can really get into all the little crevices and clean out the canal better. Next, they may use the hypochlorite again. Again, this is a cleaning solution. And then there's a new solution called EDTA. This one specifically opens up the pores inside of the canal. So the little channels that get blocked up from when they were filing, there's bacteria and the nerve and stuff. So they need to open those up now and clean them out. Once they are opened up, they agitate and then they cleanse them out again. Here you can see they are now doing a pattern of agitating and cleansing. Next, they will use a special suction and they will use a paper point to dry everything up, sometimes multiple paper points. So basically they just disinfected everything in there and now they are drying it all up to get everything out of there. Then it's finally time to seal it up. Gutta percha is a rubber-like material that fills in the canal. Here you can see the gutta percha dipping into the sealer, which gets in between the gutta percha and closes the voids. You can see here the gutta percha is being placed in there now, and then they will use a down packer to condense the gutta percha, so it's making sure it fills a 3-dimensional space rather than a 2-dimensional space. Now the condenser will help pack it in. Next up is the backfill, and now condensing the backfill. In this specific case, the tooth needs a little more decay removed from the side before they fill it, so they're going to do that now. And the plan for this case is to put a temporary filling on it until it heals, and then they could put a crown on it later. So here you're seeing them prepare the tooth for the filling with the etch, and then the solo, and then the fill. Once they are done filling the tooth, they will remove the clamp and the dental dam and all the stuff in the patient's mouth, the bite block, saliva ejector, etc., and then polish up the tooth, make sure it's nice and smooth and comfortable, and lastly, they will take another x-ray. Some root canals will need 2 appointments to finish, and some will only need 1 afterwards. The tooth will be restored with a filling or a crown. I will link those videos of mine in the description box if you'd like to learn more. And that's it. Root canal appointments are relatively easy, but they are expensive. And also, you know, after the root canal comes the crown, or in some cases a filling if it's a front tooth, but whatever it is, it adds up. So to avoid all of that and save your money, make sure to click the link in the description or in the pinned comment below to sign up for my free oral care guide. Keeping up with your daily dental habits at home really does make a difference in prevention. And I hope you enjoyed this video. Please like, subscribe, and turn on your notifications if you did. And if you want even more dental tips, you can hang out with me on Instagram at Teeth Talk Girl. Peace, love, and teeth.